For a year now, COVID-19 has impacted lives across the country and around the world.
Our community is dying.
And while it's impacted all communities, it seems minority communities have suffered the most, especially the African American community.
The African American community has been, hit real hard.
But why? Most say it's rooted in centuries of mistrust.
When it comes to vaccines, we've been like the guinea pigs.
So what can be done to change that? We'll examine that and more right now in From Virus to Vaccine, COVID-19 and the Black Community, a KDKA TV special. Hello and welcome to a very special 60 minutes of television from virus to vaccine, COVID-19 and the Black community. I'm Lynn Hayes Freeland. And for the next hour, we are going to unpack some of the issues facing our community, some of the concerns, some of the questions you might have about the virus, the vaccine, and why we are not moving forward tonight. This evening, I have a very special panel of guests with me. We're going to answer some of your questions. We're going to look at our history. We're going to look at how we got to where we are and how we move forward. So how did we get here? Well, let's take a look at our history. The number of African Americans lining up to get the COVID-19 vaccine has been increasing, but there are still a significant number of people who say they will not or probably won't get the vaccine.
We have a history in medicine of really mistreating Black people, African American people for sure. And people hold on to that to say, I'm not sure that this is something I should embark on until other people prove that it's safe.
Many quickly point to the Tuskegee syphilis experiment as the basis for that mistrust, a 40-year trial that ran from 1932 until 1972, when a group of African-American men were promised free health care in return for their participation in a study of syphilis treatments. But there were no treatments. There was no penicillin. The study lost funding and 128 men died, either directly from syphilis or related illnesses. But doctors using people of color for experiments started way before Tuskegee. In fact, it dates back to 1721 during a smallpox outbreak in Boston.
They had many people, thousands of people dying. And then one of the doctors decided that maybe giving a small aliquot of the smallpox to a candidate can decrease or cause them to have the disease, but not to the greatest extent. So he decided to do this on a group of slaves.
Slaves used as guinea pigs to learn about smallpox, but that was nothing compared to what happened next.
Dr. J. Marion Sims, who is considered the father of OBGYN, the women's surgery, he did experiments on slaves without anesthesia to perfect his trade.
Sims reportedly conducted surgeries on slave women from 1845 to 1849 without their consent before perfecting the anesthesia technique he would later use on white patients.
We always talk about the history of what's happened in medicine we're talking 400 years, not just, the things that we remember that people told us about.
Simmons says one of the biggest stories that circulated from one generation to the next, particularly in the South, was that of the night doctors.
There were some people called night doctors, and these the white medical schools needed cadavers and they needed people to experiment their trade on. And so Blacks were petrified in certain cities that had large medical schools because at night, these people would go and kidnap Blacks and use them for experiment. You'd never see them again.
But not everything was done under the cover of night. From 1909 to 1979, tens of thousands of sterilizations took place across the country as 33 states had recognized eugenics laws on the books. Those laws made it legal to perform involuntary sterilizations on anyone, elected officials, determined to be unworthy of procreation, which often meant Black.
They would have medical students practice on these women, Black women primarily, that came into the hospital for another reason, but they end up losing their uteruses in the process without having any consent.
Family members or neighbors disappearing at night are one thing. But other reasons for distrust are a little more concrete, like the story of Henrietta Lacks. In 1951, she was treated for cervical cancer at Johns Hopkins University Hospital. But what she didn't know was that her cells would be used for years to come without her consent or compensation for medical research, a line of cells still used for research today.
It turns out that her cancer cells seem to be able to survive really well in the experimental conditions, and they use them and have used them all over the world for cancer research, for immunology research, for infectious disease research without anybody's consent, especially not hers or her family's.
In 2010, the Henrietta Lacks Foundation was created to benefit not only her surviving family members, but other families within the Black community who had become unknowing participants in scientific research. Her family got paid, and so did the men from the Tuskegee syphilis experiment. But for many, the damage was already done. Trusting the medical community was a gamble, and people of color didn't often win. So stories of mistrust had been passed from one generation to the next. In 2021, the haunting question still lurks for many African Americans. If I go, if I participate, will I be treated the same as everyone else?
If we talk about the modern day distrust of the medical system, we're talking about every single day walking into all of our institutions. And we're talking about there's no institution that is exempt, and we still are not getting dignity, respect, and proper, care as it relates to who we are and what we need.
One of the biggest differences now is access to information and the ability to process information differently than before. In 1955, when the polio vaccine was initially introduced, there was skepticism, and plenty of it. But Black parents, like white parents, wanted to protect their families.
When the polio vaccine came out, they saw people around them who had polio, and they got up and they went in and they got in the lines, because they saw what was happening around them, even though they didn't know how the polio vaccine was created, but they knew they didn't want their family subjected to that.
Which both doctors, Simmons and Larkins Pettigrew, seem to agree. African Americans aren't unlike any other group of people. They want life to get back to some semblance of normalcy, but they want to feel safe with the vaccine. The bar for what constitutes safe, however, might be a little higher.
We cannot say that we don't have the information. It's out there for us. It's our responsibility to make sure we understand it and that we make the right decision around this.
We have to dispel myths, and we have to educate our people as to what is correct and how to better take care of themselves.
Dispelling myths, taking care of ourselves. How do we do that? Well, I have a distinguished panel of guests that are going to help us get through all of that we just talked about. Please welcome Dr. Claudia Craig-Beyer. She is an assistant professor at the University of Pittsburgh School of Medicine. Dr. Jerome Gloster is the Chief Medical Officer at Primary Care Health Services at their 9 locations. Dr. Rhonda Johnson Moore is a retired healthcare professional, currently serving as a consultant in the healthcare field here in the Pittsburgh area. Dr. Lisa Isaac is also a retired physician in this area and currently serving as the president of the Gateway Medical Society, which is the local component of the National Medical Association, and Dr. Utebe Essien, who is an associate professor of medicine at the University of Pittsburgh. Welcome to you all. So let me just kind of throw this out there, because we kind of looked at, we listened to all of the history, the baggage that is in our community. You look at 2021, you feel all of the questions, the concerns about the virus. And Dr. Gloster, I'm just going to start with you. I'll just throw this to you. How do we get through all of that? Because that's a lot of baggage. Many of us weren't here throughout all of that, but we know that those rumors, those thoughts, those ideas are still very prevalent in our community.
Well, and again, thank you, Lynn, for having me on tonight. I think that what I always say is we need to meet people where they are. So I think we need to always acknowledge the past and concerns about the past, but also trying to bring them into the present as far as where things are now, acknowledge the problems that we have today. Anytime we're not honest, if people feel like you're shoving something under the rug, or you won't even admit about, what just happened last week, or if you will, then they don't want to listen. The other way I like to put it is, we've all heard the expression, no one cares how much you know until they know how much you care. Well, I add to that until they know how much you care and also how much you understand. They often feel like a lot, certain individuals care about them, but you don't understand what I'm dealing with. You don't understand what has happened in my family and what have you. And so when that occurs, when people feel like you care and you understand, then they're able to, okay, let me listen to you and see if I can get past where I am right now. You've met me where I am. Now, let me see if I can move from there.
Interesting point. And that's one of the things I think where the role of African-American doctors plays. We'll talk about that in just a minute. We also have a lot of questions from the community. Let's take a listen to one of the questions that one of our viewers had to ask.
My question for the panelists, do you expect that we will have to be vaccinated annually like the flu shot?
Annual vaccines like the flu shot. That's where we'll pick up the conversation in just a minute when we continue. Don't go away.